Hello, folks. Welcome. And to kick things off, I wanted to say a happy National Apprenticeship Week. And welcome to the California Inclusive Healthcare Apprenticeships event. I am Adele Burns, and I am the Deputy Chief for the Division of Apprenticeship Standards, and I'm going to be the moderator today. And we have a jam-packed agenda today, so we will unfortunately not have time for any live Q&A, but we do welcome you to use the Q&A to ask questions, and the DAS team will do our best to follow up. So we have an incredible set of folks that we're going to hear from today. If you go to the next slide, we are going to be hearing from folks across the healthcare space. We're going to hear from some policymakers, from an apprentice who's lived this journey, from 3 different employers who have experience employing apprentices, and we'll also hear from a program sponsor. And really, our goal today with this event is to share some information with you all about some big investments and strategies around expanding apprenticeship in California generally, and also specifically in the healthcare space. And we also hope to demonstrate some really important and impactful early adopters to the apprenticeship model here in California, and to showcase why and how these different healthcare employers are meeting their talent needs with apprenticeship. And we hope to be also offering folks who are running apprenticeship programs maybe some ideas, some inspiration for designing inclusive healthcare programs and inclusive apprenticeship programs. So with that, I am excited to kick off our program in welcoming our first speaker, which is our California Labor Secretary, Secretary Palugyai. I've had the pleasure of working with Secretary Palugyai since she started in this role over a year ago, and she has been such a champion for apprenticeship and really for thinking about how to do inclusive workforce development. And she brings a wealth of knowledge and experience to this role from a career in public sector business transformation, higher education administration, workforce policy at the federal level. And we're so thrilled that she's brought her skill sets here to California. And she really brings her skills and her passion and her expertise to our landscape. And bonus, she is also the first Latina to serve as California's Labor Secretary. So welcome, Secretary Palugyai.
Oh, Adele, thank you so much. Let me confirm that you hear me first and foremost before. Okay, yes. Fantastic. Yes. I want to welcome everybody, and gosh, what a time in California to be talking about apprenticeship, but also to really be centering workforce issues as a key solution to making other initiatives work well. And in this case, aligning goals in workforce and strategies in workforce with outcomes in healthcare for our communities. Very exciting time. And I want to thank all of our speakers here today, and to all of you who are present, and to all of you who are working either on developing apprenticeship programs, considering apprenticeship programs in your space, working with folks that want to enter apprenticeship programs. I just want to say thank you. We are here for you. We have so many resources to share, and are excited about the future in California and what it means in terms of healthcare.
Amazing. So as we know, California's healthcare workforce crisis is certainly ongoing. And of course, the recent pandemic put a big spotlight on some of the shortages of essential healthcare workers, and in some cases made it even more acute. And certainly, these shortages exist across geographies, occupations, but they also disproportionately impact women, people of color, and socioeconomically disadvantaged communities. Can you talk about what the administration is doing to strengthen its healthcare workforce in order to minimize this impact, and also to provide employers with a resilient talent pipeline of skilled workers?
Yeah, I mean, I guess the most important answer to this is that we have a governor that has put so much funding behind the healthcare workforce and the challenges that we are seeing. I just want to outline some of this. We keep talking about it, but it's really important for folks out there outside of Sacramento to understand how much is being put toward this work. Over the last 2 years, the governor made, of course, historic healthcare related investments. And this year alone, $1.6 billion was dedicated to upskilling workers into in-demand healthcare occupations, including nursing and community health workers, dental assisting, hygienist positions. And this came shortly before a recently published study by Mercer, one of the world's leading professional services firm in the areas of risk and strategy, that COVID fatigue and an aging workforce and population will see California losing 500,000 members in the healthcare workforce by 2026. So putting that in perspective, by 2024 alone, we're expecting significant vacancy rates above what we already have, and also job openings in registered nursing positions, home health aides, physical therapists, just to name a few. So the $1.6 billion alone for healthcare workers and to develop a healthcare workforce is really significant. But there's more investment that aligns specifically with apprenticeship that I wanted to mention very quickly. In the last budget, in partnership with the legislature, we also have $65 million that is focused on youth apprenticeships. So how we think about our population 16 to 24 and how we create these pathways into different sectors, healthcare being one of those. The California Apprenticeship Initiative, which has been around for a little bit, has $56 million to develop apprenticeship and pre-apprenticeship programs. And for me, the most exciting, it's something we really were advocating for, and the governor definitely supported, and so did the legislature, was $175 million. It's the first in the nation formula funded, dedicated to supporting the development, deployment, and scaling of registered apprenticeship programs. And so the structure is designed to reimburse on a per apprentice basis, and covers the cost up to a certain dollar amount per apprentice, different expenses that are related to the development and ongoing management of these apprenticeship programs. So different programmatic expenditures, including outreach and recruitment, assessment, mentorship, back-end and administrative compliance. And it also supports the cost of training, including tuition, RSI dollars, as we call here, and other instructional related expenses. So it is a huge commitment focused on apprenticeship, and specifically non-traditional apprenticeships, of which healthcare is going to be just a massive sector that we're going to be focusing on. So I would say the commitment, in funding is really the biggest way that this administration is strengthening our healthcare workforce and our apprenticeship programs.
Amazing. So exciting. Such big investment.
It's huge.
Right. So you highlighted a number of in-demand healthcare roles that clearly require some formalized and credentialed training, right? So can you expand a bit on how California is leading the nation in utilizing the registered apprenticeship model to train workers into these roles and other allied healthcare occupations, including those that require licensure?
Yeah, I mean, there are several ways. I mean, we can talk a little bit about what's been done historically here and how that's informing a lot of what we're thinking about. California was the first in the nation to develop an LVN to RN registered apprenticeship pathway. And LVNs in our California correctional healthcare facilities, they complete a rigorous 13-month clinical studies program to become registered nurses. And I'm really excited because you're going to be hearing from Alexis Barba, I believe, who's a graduate from our very first cohort, and she's going to be speaking shortly about that experience. That program highlighted also how we might be doing more of this in public sector, and how public sector employers can really use registered apprenticeship programs to meet their own workforce needs, including addressing high vacancy rates, which everyone is currently facing, particularly in the public sector, that provide really vital services to the public and other stakeholders. The LVN to RN program, it began with a collaboration between the state and one local education agency, and now we have academic partnerships in 3 separate regions of California, including in a rural area of the state where the demand for these healthcare workers and professionals even greater, and the availability of the qualified talent pool in these communities is often scarce. So, this is just one example of how we have been very committed to scaling this and other apprenticeship programs to assist healthcare providers who need to hire more registered nurses. California is also really proud to have apprenticeship programs with two of our nation's healthcare giants, Kaiser Permanente, Dignity Health, both of whom have representatives joining us today. And this program sees a strong collaboration between the employers and the SEIU Ed Fund, who represent employees in many of the vital, good-paying, high-quality jobs within these healthcare institutions. To get specific, some of these occupations include hospital and ambulatory coders, medical assistants, surgical and interventional radiologic technologists. Someone laughs that we should all try to say that 3 times really fast. And in addition to our nursing program, this is another great example of how licensure occupations can be made apprenticeable. And because they're registered apprenticeships, it affords program sponsors access to additional resources, including consultancy services through our own apprenticeship and workforce innovation unit, which is free of charge to anyone, as well as access to a slew of the new funding that I just talked about. On the licensure theme, we developed our first registered dental assisting pilot program a few years back, and now we're collaborating with the California Dental Association to create a statewide registered dental assisting program. And this effort is going to assist dentists from across the state who are experiencing recruitment and retention challenges around these important roles. And it's also going to feature a partnership with a Bay Area nonprofit who will administer a pre-apprenticeship component. We're going to talk a little more about that. That's linked to this program. So incorporating an 8-week boot camp, as we call them, is going to better prepare candidates prior to moving into these registered apprenticeship programs so that they can achieve stronger outcomes, both as apprentices and, of course, the employers in terms of retaining those apprentices. And lastly, I think it serves as a great example of how the registered apprenticeship model can be utilized by an employer of any size. So the things I just talked about, whether you're a large healthcare institution like Kaiser and Dignity Health or a small dental office with 10 or fewer employees, the apprenticeship program can be customized to fit your specific needs. And we're really focused on scaling both models, large employers and small that take on this apprenticeship model.
Amazing. Well, you laid great groundwork for the conversation we're going to have today, and it's so exciting to have all these programs to feature and to sort of demystify how all of this can work. So you've referenced several advantages of the registered apprenticeship model, including the ability to, customize to the occupation, certainly access to these big sources of funding, the supportive resources that we as the state can provide, to make it easy for companies of all sizes to adopt the model, right? What are some of the other compelling reasons for employers and apprentices, for that matter, that may want to pursue developing a registered apprenticeship program or to enroll in one?
So there's a couple of advantages that stick out to me that I think might be worth talking about. The first is diversity. And let's just take the healthcare sector as one sector. This is also applicable in IT and other sectors. So we know that our state is becoming increasingly diverse, and yet we see huge disparities within the current healthcare workforce that doesn't reflect that demographic shift. We have healthcare professionals that don't have the cultural competence or the lived experiences that the communities they serve have. And there are many healthcare experts that would argue that not having that cultural competence and the lived experience within the workforce that serves those communities actually has adverse impacts on the outcomes, the actual healthcare outcomes. So diversity is important, not just because diversity is great in and of itself, but because having that within your workforce can impact better outcomes that we're seeking for our communities and their health. I would also say that minorities tend to be underrepresented in higher compensated roles and disproportionately occupy lower wage frontline occupations. This is true in many sectors, and in healthcare, it's also very true, including direct care roles that were really affected during the pandemic. So I believe individuals are really eager to gain access to these roles, and employers are very eager for diversity because it will impact their outcomes. They want different, diversity of thought and experience, and that is something that, these apprenticeship models can offer. I think there's some other benefits. Definitely, we have to think about the power of all the partnerships that are created around apprenticeship. So program sponsors enjoy really strong supportive partnerships through these linkages. And I'll just talk about a couple of these partners. We have apprenticeship intermediaries. And for those who haven't heard this term yet, it was somewhat new to me, and I've been very well educated on the role and the importance of apprenticeship intermediaries. They can be regional or sectoral intermediaries, and they're increasingly playing an important role in the apprenticeship ecosystem. In the case of regional intermediaries, they're uniquely positioned to assess and prioritize local community workforce development needs and to bring stakeholders together from across the region. And for sectoral intermediaries, they really specialize in sectors like healthcare or IT or logistics, and they are tailoring apprenticeship programs by integrating the industry trends, the best practices, and emerging technologies. They're also really well suited to support the deployment and the ongoing support of the registered apprenticeship programs, the recruitment of candidates into these programs. So they're a really important player that are really shifting sort of the model and helping us scale. Of course, other partners include local education agencies, workforce system partners, and I don't want to at all underestimate the role of CBOs. More and more, we are seeing and promoting the partnership of local CBOs in the apprenticeship ecosystem. And these CBOs are really helping employers in the recruiting. So they're recruiting in targeted populations. But even more important than recruiting, they support the participants of apprenticeship programs throughout their journey with wraparound services, trauma-informed services, and career readiness services like pre-apprenticeship programs. And these models are really important because they are developed and linked with registered apprenticeship programs in order to ensure stronger outcomes for the participant, more retention during the apprenticeship program, and they sort of serve as a pathway into these apprenticeship programs. And I think maybe lastly, so we talked about partners, we talked about diversity and why that's so important, particularly in healthcare. I would say a third piece to consider is sort of the role of stackable roles or credentials. So many of our registered apprenticeship programs are designed with an eye toward upward mobility by stacking roles and credentials. And this is really common in sectors like IT and healthcare, and can be very effective in bringing individuals into entry-level roles and providing a pathway to higher paying positions within that sector. And it's a high priority for us as well as we look to develop more registered healthcare apprenticeship programs that are thinking about not just the entry into the sector, but growth within. This is going to be key for moving underrepresented populations from the lower paying jobs into the higher and more livable wage jobs as well. So those are three areas that we could probably talk about more, but I think those are probably some of the key ones.
Amazing. Well, thank you so much for all of your participation and also just for your advocacy in all of this work. It's really exciting to be bringing this all alive. Any closing thoughts?
No, thank you for the time today. And again, to everyone who is here with us. I know I talk very fast and I have a lot I want to say. I think the key takeaway here is we're really at a very important crossroads. One, because we're confronting this alarming deficiency of, critical and qualified healthcare professionals that we need to serve our communities across our state. And sort of the current system where we tap into very highly skilled healthcare workforce is in many cases archaic, and it's not serving employers, workers, or the Californians who are really relying on access to quality health care. So we have this challenge, but then at the same time, we have this great opportunity. We can be pioneers and instruments of change by supporting and providing resources to help employers develop registered apprenticeship programs. And the time is now, because the funding is here, the commitment is here, and we view ourselves as partners to help guide sectors, employers, large or small, intermediaries, all of the partners that make apprenticeship programs successful in our state. We already have models of success. Now it's just about adapting, modifying, and scaling within the healthcare sector.
Wonderful. Well, thank you so much, and thank you for being making this a special event with your presence and for advocating for this work. It's a pleasure to have you as a champion.
It's great to be here. Thank you.
All right, thanks so much. So with that, I'm really excited to introduce our next speaker, Lexi Barba. So Lexi joins us from having completed the Licensed Vocational Nurse, LVN, to Registered Nurse Apprenticeship Program that we just heard Secretary Palugyai talking about. And that program is that collaboration with SEIU and the California Correctional Healthcare Facilities. So Lexi completed her registered nurse degree through participating in that program. And we're so excited to have her here and sharing a bit more of her story today. So Lexi, welcome.
Thank you for having me. I'm really excited to be here. And I love hearing that this is still going on and we're taking advantage of this program. And I love to see it expanding as we go throughout the years since I've graduated. I'm really happy to see this being done still.
We're all working to build upon the amazing foundation that you were a part of. So Lexi, I understand that you always dreamt of being a registered nurse. Can you talk about your journey to become one, including the circumstances that led you to enroll in this life-changing registered apprenticeship opportunity that was sponsored through your employer, which I understand, was the state of California. So tell us a little bit about that journey.
So I became I was going to school to do RN classes, and it was really, really, really hard to get into the RN program as far as like finishing the classes. Let me give you an example is that if I needed a chemistry class, the classes would become full really, really quick. So I would sometimes have to go to the class, sit in class in hopes that students would drop on their own. And I would sit in the back of the class just to show the instructor that I was serious about taking the class because of the registration became full quick. So I would go every day to class, hoping these students would drop. And that would be my way to even get into the class so that I was able to finish my prereqs for the RN. Next, applying to the RN program was very challenging because of all the applicants that you were going, they're competing with. And you're also not only competing within your San Joaquin County, you're competing with anybody was able to apply to RN programs. There was no limit or boundary of how many students can and cannot apply. So the amount of applicants was a challenge of getting into the program, also finishing the classes in time in order to apply. So at that point, I decided to do LVN for me to have a quicker advantage to get into the RN program because it was so challenging to get into the RN program. Being an LVN to RN, I felt like I would have more points or more experience. At that point, I became an LVN. I started working for the prison, but I still continued to go to school to complete my RN classes. One day, there was an application for the apprentice program at my job at California healthcare facility in Stockton, and I applied as an LVN to RM program, apprenticeship program, and they were choosing LVNs to do the RM program while still working part-time, but getting paid full-time benefits, health benefits, and you're also getting paid a full-time check. So that was part of the application. So when I got accepted to the RM program, I was the first to get accepted and graduate from the RM program at San Joaquin Delta College. That forever changed my life. I'll never forget the unsurreal feeling of the support and this opportunity to finish the RM program. Through the apprenticeship, I will always be forever grateful and thankful that I was accepted and finished and was a part of this journey. It was very, very tough. The things that would go through my everyday life is I support myself. No one supports me. I live on my own. I pay all my bills on my own. How am I going to do the RM program while still supporting myself? Was also another challenge. How am I going to do a full-time program 5 days a week, sometimes with clinical and book work and study, is going to require full-time school. Even when I'm not at school, I'm going to be studying. How do I live? How am I going to support myself? So that was always a challenge that I had to figure out on my own as well. With the apprenticeship, that eased my worry of not being able to make money while going to school full-time, because the apprenticeship allowed me to still have a full-time check, also still allowed me to have my full-time health benefits while working part-time, and was able to attend my full-time classes in the RM program, was able to have my books paid for through the apprentice program. For nursing books, they're thousands of dollars. So it adds up. So I will forever be grateful and thankful that I was a part of this program. It changed my life. I am now an RN full-time for the state of California currently. Currently, I am working as a on-site doing pre-op nurse at this time. I am able to now be able to support my family. I was able to finish the RM program in good standing. And I'm just forever thankful. I can't stop saying the word grateful. Very, very grateful. And I love seeing the state of California and the budgeting expand this in different regions and in different parts of healthcare as well.
Amazing. It's so awesome to hear your journey. And I'm curious, in a registered apprenticeship program, it's designed to support apprentices through, structured training, mentorship, tutoring, career coaching. I know that this particular program was launched in a collaboration between SCIU, Local 1000, and the state of California with the correctional healthcare facilities. I'm curious, can you talk a little bit about how did you feel supported through your journey, and how did those different sort of systems of support help you to get to the completion point in that program?
Through the support of SEIU and the state of California, also for San Joaquin Delta College, the support of tutoring was there. We had a specific tutor, Miss Summer. She was actually a tutor just for the apprentice, and even off the clock, she was still supportive in any concerns, questions, studies, like tips that were there. We were able to have study time just like in the library with Summer, who was also our tutor. She was amazing. The support from San Joaquin Delta College and, the books and the scheduling, also with staffing at my facility was very, very supportive, and management was very supportive, along with SEIU. Everyone was very supportive, and making calls to the apprentices as myself. I would get calls from SEIU. How are you doing? Is there anything we could do? How do you feel? It was an emotional support and also a physical support to help facilitate this apprenticeship to be successful. And I would want to say 100% it was successful in support and with scheduling and just calls. I mean, I would call sometimes Sarah, and it would be at 7, and I'm like, Sarah, and she was just there. Kelly Mackey, we have been in contact as well, supportive of, is there anything we could do? All of the management and SEIU, very supportive. Calls, never too late, never too early, always an email, quick responses, amazing. I think it's an amazing journey that I was able to go through, and forever appreciate that.
Amazing. Well, thank you so much, Lexi. We really appreciate you being here, and we're so glad that you have felt so supported in this journey. That's absolutely what we're striving for when we put together programs, is that we're creating these opportunities, and part of what I think is unique about the apprenticeship opportunity is that hopefully it is this like structured and supported pathway. So thank you so much for joining us.
Thank you.
Great. So with that, I'm now looking forward to shifting our focus to the employers that are the driving force behind these programs and that are thinking about talent differently and meeting their workforce needs through apprenticeship. So I would like to welcome two great folks to this conversation, Wiley Adams and Don Bradburn. Welcome to this conversation. So just to provide a little introduction, Wiley Adams supports the Employee and Labor Relations team within Dignity Health here in California. Nationally, it's known as Common Spirit Health. And Dignity Health is a management partner and a contributor to the SEIU United Health Worker Joint Employer Education Fund. And Dignity participates as a board member. And certainly this partnership has enabled dozens of programs, including the statewide medical coding apprenticeship program, which Wiley specifically supports. So we're excited to hear more about that. So welcome, Wiley.
Thank you.
And Don Bradburn, he serves as the Senior Director of Human Resources Strategy Design in the Workforce and Planning and Analytics at Kaiser Permanente for Southern California and Hawaii markets. And Don has a wealth of public sector and HR experience, starting working with the U.S. Military Intelligence Corps, and after being honorably discharged, he worked in the public sector in HR with Health and Human Services Agency, and in 2018 shifted towards the private sector in joining Kaiser. And so we're so thrilled that both of you are joining this conversation here today, and that you are both working with the Ed Fund and the Shirley Ware Education Center in this apprenticeship program. So welcome to both of you.
Thank you.
Thank you.
So to kick off, can you just tell us a bit more about the apprenticeship program that you're participating in, and give folks kind of an overview of the occupations and your experience as the employer?
Sure, I'll kick it off. It's already been mentioned, but one of our main apprenticeships that we're running right now, in fact, is a medical coding program. And maybe a couple years ago, I didn't know this existed, but it's a real back of the office, very important part of the operation. So anybody that comes through to the hospital or clinic, whether they get a diagnosis, a test, a procedure, and an x-ray, it's charted and it goes to our medical coders, and they're responsible for understanding what they're talking about. They need to know about the body and medical procedures, and they bill accordingly, whether it's private health insurance, Medi-Cal, Medicare. So it's a real important part of our operations revenue cycle as well. So these folks are pretty important, and we currently have an apprenticeship for over 20 non-coder to coder 1, so it's an entry-level position for coders. Our pool are current employees. They could be transcriptionists, patient financial, billing, individuals in our ED. So a wealth of experience at Dignity Health in their various departments, and have showed an interest in coding. So it's, we're able to connect these individuals that are interested and a need. Coders they're very impacted. It's hard to recruit. So we grew this apprenticeship, started at a pilot, and it's grown to a statewide program. And one of the silver linings of COVID is that we were able to go online, and people are becoming much more adept at that. So we can really do the training and the OJT of an apprenticeship online, which has given a lot of flexibility, not only to our operations, but more importantly to our apprentices. So that's some of the employer experience. We've been able to tailor the apprenticeship to make sure that we are providing the information, we're covering the education that is needed, our own procedures and processes, and giving it a safe environment for our apprentices to succeed, really. So it's something that I feel really passionate about, and I love hearing the stories from Alexa, because I've gotten very similar feedback from our apprentices that's really kind of changed their lives, and also from an employer perspective has been an extremely successful model for us.
So I'll just kind of piggyback on that. Kind of similar experiences to what Wiley's seeing as far as the workforce's response. Southern California, at Kaiser Permanente, Southern California, we had launched our first apprenticeship, which was sterile processing. And now we're on our 4th cohort. We've also expanded our sterile processing program, our apprenticeship programs, to not just include sterile processing, but surgical tech, ortho tech, optical dispensing, IR, interventional radiology, diagnostic imaging. And, we continue to look for other areas of opportunity, and one of those might just be MA to LVN programs. But we also expanded in the Hawaii market, what started in Southern California. And interestingly enough, in Hawaii, they don't even have a sterile processing program anywhere on the islands. And so it's really important for them to have an apprenticeship, because that's really the only way they're going to be able to get people, other than trying to recruit them from the continental U.S. And then how did we get started? So I think that's probably a good thing to share with people. It wasn't like one day we just said, hey, let's just do an apprenticeship. Although if that's what you want to do, that's great too. But we were looking at an area where, the chief of perioperative services, was really concerned about turnover and vacancy rates with sterile processing techs. And so sterile processing techs for non-healthcare people, they're kind of the heart of a hospital. They touch everything, and you want them to be well-trained, because they're the ones who are going to ensure that disease and viruses and all sorts of ugly things don't spread. So, they play a very important role. So, people often overlook them, but they're critical to operations. And so that chief medical officer was just really concerned about that. And people were turning over. And so we looked at it, and we saw that the higher turnover was with people with less than 2 years in an organization. And that prompted the conversation to say, well, what if we took frontline staff and we upskilled them? and then gave them experience. And that was the foundation to what became our apprenticeship program. And so it pulled from the line staff, mostly like our healthcare, housekeeping staff, some from food and nutrition, but it was a platform for them to actually start to move in a more clinical role. And so it's been great. Timing couldn't have been better for us because shortly after, I think our second cohort was about to graduate when the lockdown happened and we were in the middle of COVID. And it was nice to know that we had, we were well staffed in the sterile processing area, that we weren't losing people, that we had fresh blood who were excited and engaged and ready to go. And as we move into this, nowadays with the Great Resignation, we see turnover in other areas higher than we've had before. But the one area that we don't stress over is our sterile processing, because we have lower turnover. We have people, we upskilled that had been with the organization 11 years. That's a commitment. And it was time we committed back to them. So, it's been really good for that aspect. I'll tell you, because of growing pains, my last point is sometimes getting buy-in from managers is hard. It's new and they're skeptical. It's just human nature. They sit on the sidelines. You have some people by nature are ready to jump in. And then others will say, I don't know. And then there's those who just say no. But what we saw was we had a lot of them who jumped on it, did the first cohort. By the second cohort, more were getting in. And now we see every service area saying, hey, I want part of that. And so it continues to grow. Managers see it as a viable solution to their staffing, and employees see it as a great opportunity to build a career. And with that, I'll kick it back to you, Adele.
Amazing. It's so, I love to hear those retention anecdotes because I think that's one of the things that we certainly tell folks about. And so it's amazing to hear how that's like come to life in a for you all. So we know from strong statistical data that registered apprenticeship offers companies a talent development approach that also onboards a more diverse talent pool. Can you speak a little bit to your organization's perspective and commitment to offer career opportunities to underserved populations and how the registered apprenticeship model has helped your organization accomplish this goal?
Yeah, I'll go first if you're okay, Wiley. So I think for us, it's been a great opportunity that the sterile processing ones, I'll just kind of share there, like we have had 100% diversity in every one of our cohorts. All right, that's where the most of our staff are, in those frontline workers are very diverse and often underserved communities, and this is a great way for them to come up. Working with the Ed Fund, and as a trustee, I can tell you, with Dignity and Kaiser, our employees, there's 80% are women, 78% are people of color. And these people are getting into these apprenticeship programs, taking advantage of opportunities to grow. And I'll just give a reference point because I like to pause because sometimes people wonder like how much of a difference in, these often make a big difference in people's lives and their trajectory. To give you just a data point, our average worker who joined the apprenticeship for sterile processing, when they graduated their sterile processing program, got a $5 an hour pay raise. That's $10,000 plus a year. That's almost $1,000. That's life-changing. That's noticeable, even after taxes. So that's the kind of thing that we want to do and build careers where people can kind of make those steps. That's important to them. Many of our people are primary wage earners. Some of them are single parent households. In Kaiser, we always tell people, meet people where they are. And I think apprenticeship is a good way to actually meet your employees where they are. It's not to say, hey, you're a great employee, go to college and then I'll talk to you. It's like through their own life's experience, they just haven't had the opportunity. And it's hard when, they want to move up, but you have a structural system in place that doesn't always facilitate that progression in a career and in society, and that it doesn't allow you. It's much more difficult. As Alexia was talking about there, those challenges, like I got to support myself. Sometimes I got to support myself and my kids. And then how do I go to school and how do I do that? And this, I think, kind of puts in place an opportunity that doesn't exist. It fills that gap. where colleges, people can't go the traditional route for whatever reason in life. It doesn't matter. What matters is we look at the talent for what it is, and we help it grow, the talent grow and become what we need. And so that's kind of our experience. The other piece I'll share, just kind of anecdotal, I don't want to monopolize too much time, but we've engaged apprenticeships in all entities. One of the good successes is our Baldwin Hills Crenshaw facility, and I'll share what that was. Baldwin Hills Crenshaw, for those of you who don't know, in the LA area, is a very underserved community. It's been promised a lot and received very little. But when we went to build our MOB, our medical office building in that neighborhood, we committed to the community. We partnered with the Workforce Center in the city of LA to find people to fill our roles in our medical office building from that community. We even went a step further. As we were building the building, we asked the builder to partner and work with the community too, and they partnered with Second Call, which is a nonprofit that helps people who've been incarcerated find productive work and get their foot in society. And they do that through the trades apprenticeships that are out there. So they built the facility. There was a lot of hours of former prison labor that went into that were learning new skills. And then the staff we hired took advantage of the opportunities the Ed Fund had. And many of them went to become MAs, medical assistants. And a lot of them now are saying, hey, I want to become an LVN. And so it goes to show you that seeds have been planted and people are starting to grow and it's catching on. And promise, Wiley, I'll be quiet now and let you have a chance.
No, that's great. No, thank you. And it's not dissimilar at Dignity Health. With our medical coders, I think there's only one, from a gender perspective, there's only one gentleman in the program. And through knowing these apprentices, they have, families, their parents. There are, this coding apprenticeship has allowed us to have apprentices in Bakersfield fill positions in the Bay Area, which, arguably is a difficult market. And so it's provided us some flexibility. It's provided opportunities. We had, as a kind of anecdotally, we had one apprentice actually had a baby during the program, and we were able to accommodate her. And, that's a real, and, in speaking to her, it's real life, and it provided some color for myself as well. There's individuals that are given this opportunity, and this will affect their families. So, and I haven't done those statistics, but I should. But I've heard just a huge amount of the impact for their families as well. So, I think Alexa mentioned that as well. So.
Wonderful. Well, this has been just so wonderful to hear the employer perspective. So thank you both for being champions of this work and for for championing having apprenticeship and creating these opportunities for folks. So thank you so much for joining us today.
Great. Thanks, Adele. Thanks for giving us the framework.
Pleasure.
Absolutely. So next, I am excited to chat with another healthcare employer, but one that is operating a small business and also looking to apprenticeship to fill talent needs. So I am happy to introduce Dr. Natalie Provenzano. So welcome to the conversation. Dr. Provenzano has wanted to be a dentist since she was 8 years old and has been practicing dentistry since 2002. And certainly has an impressive educational path, including Loyola Marymount and University of Southern California, where she got her dental degree. And one anecdote I love is that she was awarded the Female Dentist of the Year award. So we're thrilled to have you join us. And we also know that you have, of course, a dental assisting apprentice in your office. So we're so excited to learn more from your experience. So just to kick off here, can you tell us a bit about your apprenticeship program and give folks an overview of the occupation and sort of what your experience has been so far?
Yes, yeah, thank you so much for having me. I'm pleased to be part of this group today. But basically, I've had my apprentice with me for a year now. She's just about to finish up her program, and her program's a little over a year, and it's a dental assisting apprenticeship. And a little while back, we were emailed. I don't know, just maybe a bunch of dentists were emailed and said, hey, who would be interested in taking on this new program that we're starting up? And apparently there were about 50 dentists on this call that responded, just to show, the need that's out there. And I think there are about 12 people in the program. And so what they did is they said, okay, we're going to, work on resumes with these students, with these apprentices, and get them started, get their, background stuff taken care of first, so that when they come into your office, they have a basic understanding of sterilization and safety, and they've had their, proper immunizations and whatnot to work in a dental office. And so I think that was probably about 2 to 3 months that they were working behind the scenes, in their program before they joined the office. During that time, they taught them how to go out and put a resume together, do interviews. And so I got a call saying, can I, come in and interview in your office? And what I didn't understand at the time is she was basically interviewing me to see, because there were so many dentists that were interested in taking on these apprentices, that basically the questions I was asking her the whole time, she's kind of sizing up my office and saying, is this a good fit for me? Because she had several options. And I believe she did interview at a few other places, and then emailed me and said, yes, I'd like to work at your office. And she's been a fabulous fit. So I'm so very grateful for this opportunity. But like I said, she's been in it with us almost a year, and I definitely plan on keeping her on board. Listening to Lexi's discussion about the changes it's made in her life, it's so inspiring. And I really kind of had no idea, that we were making these kinds of differences. And I'm really, I hope that my apprentice, that she really feels grateful, for the opportunity that we're giving her, because like Dawn touched on, these are students that she just came right out of high school, and the college path may not have been the right path for some of these people at the time, but to give all of them an opportunity to pursue a field, especially I love dentistry. I'm very passionate about it, and I know that just as a female, I feel like it's a great profession, and for females, and we can have children and make our own hours and really do that. I think if you're working for a good boss, that they're so understanding for the whole family, the whole, just supporting people's families and supporting what they love to do. So to have that opportunity for her, and she actually has a twin sister that went into the program as well, to give them that opportunity to come into a field like dentistry, which is so rewarding, and to learn about it, and go along, with growing in the practice, I think is a phenomenal experience. So it's really been great to see her come on board with our office and just grow with us, and to have her, my office, we have employees that have been here 25 years. We have a lot of long-term people. I'm very fortunate that I don't have a ton of turnover, and I've definitely seen a little bit of it over the past few years, but we really are a family here at this office. And so to welcome her in and to, train her the way that we feel, really reflects our passion and our, everything we work for here with our patients, who are a lot of long-term patients too. And to have her become part of our dental family has been fabulous. And just to see her grow in confidence and skills over this past year is great.
Amazing. And so I know many dental offices are small businesses, and as we know, have their own unique set of workforce challenges. And this certainly includes vying for talent with large companies, and sort of balancing that limited administrative capacity with fewer employees. And in your case, all the while also ensuring quality of patient care and all of that. So you've elected to grow your own through this registered apprenticeship model. Can you explain a little bit why, as a small business, this approach was viable and attractive option to you in order to secure those qualified dental assistants?
Absolutely. And like I said before, there are a lot of dentists looking for, really quality people out there. And there are, quite a few people looking for jobs, but it seems like in the dental field, especially, and with assisting, it's the qualified applicants or the dedicated applicants, they're a little harder to find. And like I said, I've been so fortunate that, so many of my employees have been with me, almost even since some of them since before I joined on, but they've been with me for so long that finding somebody outside, I'm finding that sometimes there's just a lack of motivation out there. Sometimes I'll get somebody that I hired that just maybe doesn't even show up, or, something like that. So, in my field, it's really difficult to find good quality, dedicated applicants. So I think it makes this apprenticeship program is fabulous because it makes assisting, it's not overwhelming, because it can be an overwhelming job. You're coming in and you're dealing with, not only the entire staff, but you're learning something new. And this is all critical stuff. We're sterilizing, we're keeping things safe for patients, we're keeping things safe for ourselves. And it can be very overwhelming for somebody, especially new to the field. And the fact that the apprenticeship program, gives them that training ahead of time and gives them that support through their whole training program is fabulous, because what I found is that, these apprentices that come in, they're dedicated. They've made the commitment to the program, and they also want to make the commitment, to their employers, and they're getting paid while they're going through this program, and it's giving them opportunities to really, excel in the dental field, and not be overwhelmed, and to make a living at the same time while they're getting their education. And I think that what we're going to be finding is that people will not only stay with their program, but stay in dentistry. And I think that's great, because these are programs that, like I said, reach out. Apparently, somebody had reached out at the high school level and said, hey, here's, a dental assisting program. And I think that when you get somebody interested in a field that they can grow with, that's, especially in some of these, like you were mentioning, underserved communities or patients or, assistants, students that may not have seen college as a viable option, but to give them a viable option where they can have a career is great. So the assisting program itself, like I was saying, I think it gives a lot of support, and I think we're going to be seeing a lot more of these students staying within the field of dentistry.
Yeah, absolutely. And so I know careers in dentistry are in great demand and are projected to see even more growth in the coming decade. In fact, according to the California Dental Association, and the recent survey showed that nearly 90% of practices have greater challenges in recruiting and hiring dental assistants than before the pandemic, which I think you spoke to a bit in how you've been living out that program, and that. So I'm curious, clearly visibility about these opportunities is essential to assist employers in attracting more viable candidates. Through your partnership with your LEA and the state of California, can you share with us how developing a registered apprenticeship program has heightened awareness about the program in your community, including for those maybe from underrepresented populations?
Yes, it's been a blessing to have, my apprentice here, but like I said, we're very kind of, my patients, they're like family. My team is like a family. So when somebody new comes in the office, they ask a lot of questions. So my apprentice has been fabulous, fielding like, oh, well, hey, are you learning? Are you new here? What's going on? So, and it's cute because at first she was very, very shy, and we kind of had to tell her like talk to the patients. It's okay, and so she's found her voice, and it's been great. But she has been probably the best advocate for the apprenticeship program, because she's been informing, my patients about it. And like I said, it really, I think they've reached out to some of these underserved communities to offer apprenticeship programs to these students. But as well as that, she really communicates well with my patients who are from underserved communities as well. So it's nice to have that connection. People come in and they can find somebody that they relate to, somebody that they're comfortable with, somebody that looks like them, or, can speak to them. And it's been really nice, again, because, especially my apprentice, she is getting paid while she's doing this program. So it's motivating, I think, for her to stick with it. I know her sister is having a good experience with it as well. And, getting just the word out there to some underserved communities about the field of dentistry, because we have so many, there's a chance for growth within the field of dentistry. So, starting in at the, as an apprentice at the associate level, certainly you can grow within your practice from that. But I know that there are opportunities to get, they're earning their registered dental, assistant degree. So they're RDA, but then there's RDA with extended functions. There's, people that become assistants and then decide maybe they want to be a hygienist. And, there's another step up from there. And then I've had, hygienists that say, oh, I want to be a dentist, so there's so many opportunities. Like I said, the dental field, I think, is fabulous. And there's so many opportunities for advancement, but really getting into those underserved communities and reaching out and giving them the opportunity to have apprenticeship programs, is really involving, it's just getting people involved in the field, which is great, because like you said, it's a growing field, and I hope it continues to grow. And I've seen, I've been in practice 20 years now, and I've seen a huge change in people's attitudes about dentistry. It used to be, oh, it's okay if I lose my teeth, not a big deal. And now people are really trying not to lose their teeth. They're trying to do what they can to save them. So in these 20 years that I've been practicing, I've been seeing a huge increase in just awareness of dental health and understanding how dental health relates to overall health. And it used to be, my older patients say, oh gosh, I never went to the dentist growing up. And now you'd hardly have patients that say, oh, I've never been to a dentist. But it is still really important to reach out to those underserved communities, because not everybody has access to dentistry still. But we're getting there. And programs like this, I think, help out with exposure to dentistry.
Yeah, amazing. And so I wonder, I'm so grateful to you for signing up to this model. And I actually would love to both ask you and our other two employer panelists here to think about your look forward state. So you have this experience under your belt of having an apprentice. As you look forward in your program, and this is, we'll go first to you, Dr. Provenzano, and then Wiley and Dawn, if you can each comment as you look forward in your program. What are your plans moving forward in terms of apprentices and maybe other occupations that you might look to use this talent solution for?
Yeah, I'll start. I'm very fortunate to have, gotten involved in this apprenticeship program. I understand it's the first dental assisting program in California. So honored that I was chosen to be a part of that, and it's worked out really well. In terms of, getting into other fields in dentistry, I think that they're, looking at this program. There's an opportunity, I think, to reach out to other, fields of dentistry. Maybe, there might be a way for hygienists to get involved. We're very fortunate. We have a hygiene school pretty much down the street, which is great for us, because sometimes we'll get patients in that need a lot of work. And, I say, hey, you can go, get this work done at the hygiene school, and, that will help you out financially in terms of getting you a great cleaning. And then you can come back to me for the, dental work when you need it. But to be able to offer that for our, maybe underserved populations, is a good thing, but not everybody has a dental hygiene school, down the street. And I think that, if the funding is there to start some hygiene programs, there are a lot of people that I think want to get into the dental field, hopefully. And I think if we just reach out and really spread the word, that these programs can be successful.
Amazing. Thank you. Wiley?
I think,
look forward state.
Yeah, I think the next steps at Dignity Health is to continually socialize apprenticeships. We've sort of, in my eyes, used the coding apprenticeship as sort of a pilot, and testing this out and socializing it with both employees and our operations. Consistently, people kind of say, oh, this training. I was like, no, it's not a training. This is a real investment requiring a lot of infrastructure and commitment I'm not a coding expert. We need our SMEs and our leadership to invest as well. But as we recruit people in previous programs, my email box is being blown up by our current, like, can I do this? Can I do this? Can I do this? And operations are like, oh, okay, there's success stories. So that's one body of work that we need to do. We're already, I'm already working with the Ed Fund and Rebecca Hansen and trying to pitch for the next program. These are multi-month programs, so it's not insignificant as far as a time investment and a funding investment, which I think dovetails really nicely with a lot of what the state of California is doing. And quite frankly, a lot of that would not be possible. The apprenticeship would not be possible because it's a big program and a very expensive program in some cases. So yeah, just trying to getting bigger wins from smaller wins, and if we can replicate that throughout the organization, I think it'd be a fantastic next step. Don?
Yeah, I think for us in the Southern California and Hawaii markets is to continue to grow the variety of apprenticeships that we have. But I think the biggest challenge, and one that's very important, is going to be kind of linking them in the sense of merging it with a career path, so that somebody who comes in as an EVS worker realizes there's a path. There's a path to go from there to sterile processing to surge tech. And a surge tech could take them on to like perioperative nursing if they wanted to, or supervising of some sort. And likewise, also doing the same thing with, building out for nursing assistants and nurses aides, CNAs. How can they start to have that same kind of thing, so we could take them and build into and link so that they could go to MA to LVN and LVN to RN. And what they then see is a career and with us, and build a more long-term relationship with our employees instead of this transactional one where we just, you do work, I pay you, and you work a little longer, I pay you a little more. But people, and I think as we talk about studies that have been done with younger generations, this is the direction they expect. They expect that investment in them and in their growth. And I like to say, with all the money we spend doing job placement and helping people find jobs when they become unemployed, there's a real good way to help slow this chronic unemployment, and that is quit giving people a job and help them build a career. And that's what the apprenticeship model does. It starts to build people a career instead of putting them in a cycle where they go and they take a job and then that job gets antiquated or gets deleted and then they have to go back to something else. That is within our organization. That's kind of what I want to see. I want to see that be how we kind of help build our communities that we serve as well.
Amazing. We are also lucky to have you all as partners, and we're thrilled that you're thinking about that, and certainly you've heard about some of the investments that we're making to try to, offset the cost certainly of launching these programs, but also, helping to sustain them. But we know that you all as employers are the co-investors in that, right? And it's absolutely, Don, I really appreciate those closing thoughts, because it's thoroughly to the benefit of all of us that we create these opportunities and help people map their way into careers. So thank you all so much.
Thank you.
Thank you.
Yeah, wonderful. So with that, next, I'm excited to shift us to one of the more long-standing healthcare apprenticeship programs in California, which is the EMT and Paramedic Apprenticeship Program with the California Firefighter Joint Apprenticeship Committee, which we also is known as CalJAC. And we are joined here by Yvonne de la Peña, who is the Executive Director, and Jeanette Placencia, the Recruitment Director. So welcome to both of you.
Thank you. Hi, Adele.
Thank you for having us.
Yeah. So CalJAC is a model of labor management partnership, and it is in its fourth decade of providing apprenticeship training, recruitment, and candidate testing services for the California fire departments and labor organizations. And Yvonne has been able to work diplomatically and effectively with labor organizations and management personnel to successfully develop and implement program policies and procedures. And as executive director since 1990, she's successfully expanded the CalJAC program to over 10,000 active apprentices and 194 participating fire departments and labor unions, which is incredible. And she's secured and administered dozens of school districts and government contracts, as well as multiple grants. And of course, some of these grants have helped to establish the first pre-apprenticeship program for firefighter, EMT, and paramedic certification, which I know we're really excited to learn more about here. And of course, she also serves on numerous boards and committees, including, most importantly, of course, the California Apprenticeship Council, where she serves as the chair of the legislative committee. So thank you for playing that important role in our ecosystem. And we're also thrilled to be joined by Jeanette Placencia, who is one of the newest additions, serving as the recruitment director at CalJAC, and she has extensive background around diversity, equity, and inclusion strategy and recruitment and retention of underrepresented communities. And we're going to hear all about how she's passionate about supporting these individuals and organizations to transform to create more equitable and inclusive society for all. So in former roles, Jeanette also led local and national recruitment efforts for programs aimed at serving historically underserved communities and worked in numerous institutions, including MIT and Boston College and UC Davis. So we are thrilled to be learning from the deep knowledge that you all bring in running this well-established program. And so to start off with, I've given a little bit of context here, but can you give us an overview of your pre-apprenticeship program?
Okay, well, I'm going to let Jeanette take that right off the bat.
Thank you. Yeah, so I think as folks have shared, there is a huge need for, in the healthcare field, specifically for first responders, and need to have diversity in the first responders so that, first responders are reflective of the community that they are serving. Another thing is that it is actually very complicated for people who don't have maybe family who's in the fire service. It's very complicated to get into the fire service. So the pre-apprenticeship programs are really filling that need. So it is for the EMT Academy, it is a 6-month program and people get their EMT course, their CPAT, which is the candidate physical ability test, and a written test. And those are the basic requirements that folks need in order to go into the fire service. But in addition to that, the program is infused in the fire service. So it is a paramilitary structure. There's a lot of support regarding mentorship, childcare reimbursement, travel reimbursement. But the whole idea is really getting people prepared to, go through the 6 months and be hired by a fire department. And again, the whole idea around it is to be very supportive and looking to create a pipeline for communities who have not historically had access to go into the fire service. Again, because it's very complicated and at times it could be very costly. So the program is completely free, just from everything from the books, the uniform, the course. And so it's a really great opportunity. And some folks have mentioned about the fact that not everybody can take time off in order to do a program that will take them to a career. And so this program really is kind of allows for people to have a job, to continue working if they need to work. It's always ideal for people not to work, but we know that especially the communities that we're serving, most likely they're going to have to continue having a job. So really trying to create a program that is inclusive and is minimizing barriers to becoming a firefighter. Yvonne, is there something you want to add?
Oh, yeah.
No, you covered that really well. And so in addition to the EMT, we do have the paramedic pre-apprenticeship program. So to get into the paramedic program, you have to have been an EMT already for 6 months. So the paramedic program is very similar to the EMT in that it provides the paramedic coursework along with, if they don't have the CPAT or the written testing, they can get that as well. But the paramedic class is much more difficult. So a lot more support in terms of mentorship and tutoring and helping individuals get through the coursework, because it goes very quickly and it's a lot of information to digest. So that's one of the things that we feel is the most important in terms of a pre-apprenticeship, is having folks there who can help these individuals with study skills and questions and homework and those types of things. So we are really excited that we just got our pre-accreditation. So we will be a accredited paramedic school for our pre-apprenticeship program, and we're going through that process right now.
Wonderful. And in terms of thinking about your recruitment efforts with your program, and particularly that entry-level program, and how you've iterated on that, can you talk about what you all have done to increase access and to ensure diversity in your cohorts?
Yeah, thank you for that question. So we know that the program is completely free, but sometimes even when you offer a program that is free and it's amazing, it doesn't always get to the communities that we're trying to serve and trying to get into the program. And there's all sorts of reasons why people don't, may not apply to programs. And so we're starting our fourth EMT Academy in January. We just started our first paramedic academy this summer. But when we were really thinking about, okay, how can we ensure that we're increasing access to these programs? Because it looked like, people who, several people were applying in the beginning. It was people that already had, a background in the fire service. And when we wanted to, think about, okay, so who are we trying to target, and really thinking about these underserved communities, we really had to kind of look at the whole cycle of this process, which included the application. So we really looked at the application and we thought, okay, how can we make sure that this application is going to not have barriers for people, right? And so we reformatted our applications. We used to have, an essay question. We removed the essay questions. We had some shorter responses, because for some people, having an essay question, it can feel really intimidating and daunting. And that doesn't mean that the person is not qualified. It just means that that question just may deter them from applying to the program. So we try to make the application inclusive. We also looked at our marketing materials, and we had marketing materials that didn't depict a man, right? But it wasn't also depicting women, right? And so we thought about, changing our marketing materials to ensure that we had diversity in the marketing materials. And it was actually very, very successful in regarding the applications that we received, this cycle. And we also looked at the interviews. We implemented an implicit bias training beforehand for our panelists, so that people could be aware of what are some biases that may show up, how to overcome those biases. We set up a rubric to ensure that people were not being, weeded out, but being included. Because a lot of times, so these programs are meant to be an access point, but sometimes when we interview, instead of seeing it as an access, we can automatically just think let's just get the person who's the most qualified, when in reality that's not the intention of the program, right? The intention of the program is to upskill, to elevate the skills that the people already have. And so so we did a lot of work around just trying to ensure that we had diversity in the folks that were applying, to ensure that we had a diverse cohort. So it's been a really great process, and we know that this is something that will just kind of continue. We'll just continue, having to iterate, with each class. We learn something new, and it's been a really good experience.
Great. Your pre-apprenticeship program is a great example of how employers can utilize this model to produce stronger outcomes by better preparing apprentices to be successful in the program. Certainly a win-win for both apprentices and employers, right? Another advantage to the pre-apprenticeship program is developing this diverse talent pool, right? Can you talk about the importance of these programs in not only producing stronger apprentice candidates, but also increasing diversity in the fire service?
Yeah, I'll let Yvonne take this one.
Yeah, so actually both our employers and labor are very supportive of the apprenticeship model, and these occupations are highly technical, EMT and paramedic, and so individuals have a lot of coursework and precepting and work that they have to do before they actually get into the position itself. So by having that opportunity of about a year, like for a paramedic, that they're actually going through the program and getting the hands-on experience and all that, by the time they graduate and actually have done their precepting and got to a point where they have their paramedic license, well, now the fire department can hire this individual and now get them in the apprenticeship program so that they can really begin to learn that fire department, that local jurisdiction, and the protocols within their county. Every county operates a little bit differently. There's local EMS authorities in every county throughout the state. And so each person who gets hired in a county has to go through their local IMSA in order to get qualified for that county. And so by having the framework of the education underneath them in pre-apprenticeship and then getting hired and then really being able to focus them in their apprenticeship on learning the skills of that fire department really helps them hit the ground running. It also, by having the pre-apprenticeship program, it creates a pool, and hopefully through the work we're doing with our pre-apprenticeship program and getting a diverse workforce in this pool, it gives more opportunities for fire departments to hire more diversity, because we're seeing throughout the state, not only are they needing more EMTs and paramedics to get into the fire service, they really are looking to diversify the fire service. So having this candidate pool ready and available for them to hire has been, really a win-win for all of us. And so they're really looking to our program to keep this pipeline of candidates coming to them.
Fantastic. So the Firefighters Registered Apprenticeship is certainly one of our most successful and important programs in California, and it produces highly skilled firefighters, obviously tasked with protecting our communities from increased fire risk due to climate change. Also impressive, of course, is the Firefighters EMT Paramedic Registered Apprenticeship Program, which trains apprentices to protect and provide critical patient care. Can you talk about the program framework designed to upskill these crucial frontline healthcare professionals?
Well, and speaking about the fire service in general and how registered apprenticeship fits into the fire service model, is that firefighters, no matter what occupation you're in, whether you're a firefighter EMT, firefighter paramedic, an engineer, firefighters train every day that they're on the job. So apprenticeship is a great model for the fire service, because you can get that related and supplemental instruction. And then when you're out doing your job in the community, you're getting that work processes, that on-the-job training. Well, in the fire service, because they service multiple types of calls, just about every firefighter who is out there fighting a firefighter, they're an EMT. So so they have to understand the fire side of things and the EMT side of things. So it's a lot to do in a job, but we don't have a lot of single role. We're starting to see a little bit more of that of single role EMT and paramedics coming into the fire service. But in general, you have more than one job. You're a firefighter EMT and you're a firefighter paramedic. And so the apprenticeship program is really crucial to, because they come in with that certification, but until they actually get in the field and they're actually using it, and getting that on-the-job experience, they're not really practicing their trade until they actually get out there. So we had and a pre-apprentice graduate our EMT pre-apprenticeship program, and he got hired by Sacramento City Fire Department. And he was saying how he really struggled. He was one of the ones top of the class. He goes, he really struggled with the real world experiences of being out there. His fire station was in an area with a high population of homeless, so they were doing a lot of EMT calls. And he said until he started really learning from his crew, like things that you don't necessarily get in the book smarts. You may know how to do an IV, or you may how to do these, certain procedures, but you don't know the real world experience of it, like maybe putting on 3 sets of gloves so that you can quickly take off a set of gloves and still have a set of gloves on so that you can do the next procedure. He goes, that wasn't something that was taught in the classroom. That's like a practical thing that you learn from a more experienced person in the field, and you learn it when you're on the job. So that's where this model is just a beautiful fit for the fire service, because in medicine or in any of those really technical types of things, you don't encounter every instance in your training. Or you may have learned, we have in our paramedic academy, our pre-apprenticeship program, we have the model there with the woman who's she's a pregnant woman, and they're learning how to deliver a baby, and they're getting that experience, and they learn it and they know how to do it. But when's the next time that's going to actually happen? So they have to continually practice and train, but then when that actually happens, it's really going to be an on-the-job experience that is really going to teach them how that's going to operate, because it probably won't be textbook for sure. So that's why apprenticeship is so important in the fire service. Because there's always something coming at you a little different, and you can learn it in the book, and you can, take it up, know the right test answers, but until you actually marry it with the on-the-job training, you really can't get proficient in your job.
I so appreciate that point, and I think it's a great message to all of the, healthcare folks here, because I think what you said is true across so many healthcare occupations, and I think it's really admirable to see how you have built this laddering, right, where you're helping people get into these roles and earning and learning and getting that experience on the job, right? And so I think it's fantastic to learn from what you all have built. So finally, the Firefighters Registered Apprenticeship Program sees a strong collaboration with organized labor. Can you expand on why that joint labor management partnership strengthens the overall structure of your program?
Well, labor is definitely a huge part of this. You need a good living wage, and somebody advocating for that living wage, and that's going to be your labor union, and good working conditions. I mean, especially in the medical field, you want to ensure that you have the right tools to do the job, and it's your labor union who's going to ensure that's happening. And when you're talking about upward mobility generating strong union jobs, I think it's really an apprenticeship that you can see that working really well. And so I think that without labor, we wouldn't have what we have in terms of even the success of our program. It's our labor sponsor who has been instrumental in the legislature and helping us grow apprenticeship and getting us these, even the grants that we got to do our pre-apprenticeship program. So our fire management very much appreciates the labor partner and the advocacy that they provide to our program. And, I think they're a voice, at the local level at every fire department, at their JACs where, they have the joint management labor committee talking about the training program within the fire service, where they really have a voice in ensuring that their members are provided, the safety and the tools they need to do their job, and the training to ensure that the whole team is safe. Because in the fire service, they operate as a team, even as an EMT or paramedic, nobody's in it alone. And so you want to ensure that your team is trained to the same standard that you're trained to, so that you can have each other's back. And I think that's critical, and that labor brings that component to the apprenticeship program.
Wonderful. Well, I will say this program, it's such a great example of not only how apprenticeship can be utilized in a highly technical healthcare occupation, right? And you all have been demonstrating that through a really high quality program over many years. And so I think that's a demonstration point that I hope is valuable to this broader audience here. And we so appreciate all the lessons that you shared here in terms of how you're thinking about diversity and trying to continually iterate and continually create opportunities to invite more people into these earn and learn opportunities. So thank you so much both for joining us here today.
Thank you, Adele. We appreciate being asked.
Thank you.
Great. So that is our program for today, and I just want to thank all of our speakers. It's been so incredibly valuable to hear all of these different perspectives, to hear about the big investments that we're making at the state level from Secretary Palugyai, about how we're investing in our healthcare workforce, how we're investing in apprenticeship, and how these two things can really come together. And also, of course, getting a picture of what it's like to be an apprentice. Thank you so much to Lexi Barber for sharing that perspective. And I really appreciate all of the employers who joined, Wiley and Don and Dr. Natalie, and sharing a little bit of the why and the how of how they have dove into this world of meeting their talent needs through apprenticeships. And then finally, to hear some ideas and maybe some inspiration about how to design a really equitable and inclusive and supported apprenticeship program with CalJack. So if you have follow-up questions from this session, we invite you to send an email here to dasawi@dir.ca.gov. And we will be providing a recording of this session. If you felt inspired and want to share it with others, we are thrilled to help make that happen. And thank you so much for your time today, and happy National Apprenticeship Week.